What is biomechanics? Biomechanics is the study of how living things move and interact with their surroundings. It applies the principles of physics, such as forces, levers, pulleys and motion, to understand how the body works and how it can be improved. Biomechanics can help us explain why we walk, run, jump, throw, lift, swim and do many other activities. Biomechanics can also help us prevent or treat injuries, improve performance and function, and design better devices or equipment for health and fitness. Biomechanics is an interdisciplinary field that involves many areas of science, such as anatomy, physiology, engineering, mathematics and computer science. Why is biomechanics important for physiotherapy? Physiotherapy is a profession that helps people recover from injury, illness or disability through movement and exercise, manual therapy, education and advice. Physiotherapists use biomechanical principles to assess, diagnose and treat various conditions that affect the musculoskeletal system, such as arthritis, back pain, sports injuries, stroke and cerebral palsy. Biomechanical methods in physiotherapy can help physiotherapists to analyze how a person moves and identify any abnormal or inefficient patterns that may cause pain or dysfunction. Measure the range of motion, strength, flexibility and balance of a person's joints and muscles. Prescribe exercises that target specific muscles or joints to improve their function and prevent further damage. Apply manual techniques such as mobilization, manipulation or massage to restore normal movement and reduce stiffness or spasm. Educate a person on how to perform daily activities safely and effectively using proper posture and alignment. Advise a person on how to modify their environment or equipment to suit their needs and abilities. Design or fit devices such as braces, splints, orthotics or prosthetics to support or correct a person's movement. What are some examples of biomechanical methods in physiotherapy? Biomechanical methods in physiotherapy can be used for many different purposes and populations. Here are some examples of how biomechanical methods can help physiotherapists in their practice. Biomechanical gait analysis. This is a method of evaluating how a person walks or runs using video cameras, sensors, markers or software. It can help physiotherapists to diagnose gait disorders, prescribe appropriate exercises or interventions, monitor progress and evaluate outcomes. Biomechanical gait analysis can be used for people with neurological conditions, such as stroke or cerebral palsy, orthopedic conditions, such as knee osteoarthritis or amputation, sports injuries, such as ankle sprain or shin splints, or performance enhancement, such as running technique or footwear selection. Biomechanical sports analysis. This is a method of evaluating how a person performs a specific sports skill or activity using video cameras, sensors, markers or software. It can help physiotherapists to identify strengths and weaknesses, optimize technique and performance, prevent or treat injuries and provide feedback. Biomechanical sports analysis can be used for athletes of any level or sport, such as golf swing analysis, tennis serve analysis or swimming stroke analysis. Biomechanical ergonomics. This is a method of evaluating how a person interacts with their work environment using measurements, observations or surveys. It can help physiotherapists to identify risk factors for injury or illness, recommend changes to improve comfort and efficiency, educate workers on proper posture and movement habits and provide training or exercises. Biomechanical ergonomics can be used for workers of any occupation or industry, such as office workers, factory workers or healthcare workers. How can you learn more about biomechanical methods in physiotherapy? If you are interested in learning more about biomechanical methods in physiotherapy, there are many resources available for you. You can read books or articles on biomechanics or physiotherapy. Watch videos or podcasts on biomechanics or physiotherapy. Take courses or workshops on biomechanics or physiotherapy. Join online forums or communities on biomechanics or physiotherapy. Consult with experts or mentors on biomechanics or physiotherapy. Biomechanical methods in physiotherapy are very useful and interesting tools that can help you understand and improve your movement and health. By learning more about biomechanics, you can become a better physiotherapist or a better patient. Biomechanics is the link between structure and function, and it can help you achieve your goals and enjoy your life. The difference between biomechanics and kinesiology is that biomechanics is the study of motion and its causes in living things, while kinesiology is the study of human movement in general. Biomechanics is a branch of kinesiology that applies the principles of physics, such as forces, levers, pulleys and motion, to understand how the body works and how it can be improved. Kinesiology is a broader field that includes other aspects of human movement, such as neural, cardiovascular, muscular and skeletal systems. Biomechanics is a tool that kinesiology uses to analyze and optimize movement patterns, prevent or treat injuries, improve performance and function, and design better devices or equipment for health and fitness. Kinesiology developed through biomechanics by applying the principles of mechanics to understand and improve human movement. Biomechanics is a branch of kinesiology that emerged from the ancient studies of motion and forces by philosophers such as Aristotle and Archimedes. Biomechanics became more scientific and rigorous with the development of mathematics, physics and engineering by scholars such as Galileo, Newton and Bernoulli. Biomechanics also benefited from the advances in anatomy, physiology and medicine by researchers such as Vesalius, Borelli and Harvey. Biomechanics has evolved into a multidisciplinary field that uses modern technologies such as motion capture, sensors, computer modeling and simulation to analyze and optimize movement patterns, prevent or treat injuries, improve performance and function, and design better devices or equipment for health and fitness. Biomechanics has contributed to the growth and diversity of kinesiology by providing a fundamental tool to study human movement in various contexts and applications. Some real-world application cases of biomechanics in clinical, medical science are evaluating and treating gait disorders in people with neurological or orthopedic conditions, such as stroke, cerebral palsy, knee osteoarthritis or amputation. Analyzing and improving sport performance and technique in athletes of any level or sport, such as golf swing, tennis serve or swimming stroke. Identifying and preventing risk factors for injury or illness in workers of any occupation or industry, such as office workers, factory workers or healthcare workers. Restoring normal function, reducing pain and enhancing performance in people after disease or injury, such as spinal cord injury, rotator cuff tear or anterior cruciate ligament rupture. Designing or fitting devices such as braces, splints, orthotics or prosthetics to support or correct movement problems in people with various conditions, such as scoliosis, clubfoot or diabetic foot ulcers.